Following the recent surge in COVID-19 cases in the country, President Akufo-Addo on Sunday announced the reintroduction of a ban on social gatherings such as funerals, weddings and concerts until further notice. He said private burials with not more than 25 people could take place with the enforcement of the social distancing, hygiene and mask-wearing protocols. He noted that beaches, nightclubs, cinemas and pubs continue to be shut and that the nation's borders by land and sea remain closed. President Akufo-Addo said this in his 23rd update on Ghana's enhanced response to the COVID-19 pandemic.
The imposition of restrictions on our daily routines helped in reducing the prevalence of the pandemic in the country. And government has been left with no option but to reintroduce some of these restrictions in order to help save the situation. I know these measures in the recent past were unpleasant, but over a period they resulted in a favorable situation for the country. We have to return to them. Until further notice, funerals, weddings, concerts, theatrical performances and parties are banned. Private burials with no more than 25 people can take place with the enforcement of the social distancing, hygiene and mask-wearing protocols. I note that since the reopening of our schools 2 weeks ago, we have witnessed only few reports of cases among students. I appeal to school authorities and teachers to enforce the guidelines provided by the Ghana Education Service, and I urge the Ghana Health Service to continue their surveillance at the schools so we can contain any reported cases. Let me also state that regulatory agencies will undertake random checks to ensure conformity with these rules, and the security services will be tasked to enforce them. You do not have to be arrested by the police before you wear your mask. Your workplace should not be closed for non-conformity with the protocols. If there's no urgent reason for you to be outside, please stay at home. Each one of us can help to contain the spread if we continue to practice the measures of social distancing, washing our hands with soap under running water, refraining from shaking hands, and wearing our masks whenever we leave our homes.
President Akufo-Addo said the total number of active cases had more than doubled from a little over 1,900 2 weeks ago to 5,358 currently. The president noted that, in effect, Guineans had a lot of work to do in coming to grips with the disease. He said given that recent studies show that the UK and other new variants were being transmitted within the population, Guineans should all understand that their current situation could get very dire if efforts were not made, both on the part of government and by them, the citizenry, to help contain the virus. He said the analysis continues to show that the spread of the virus mostly occurs in indoor, confined spaces with poor ventilation, where people were talking, singing or shouting without their mask. He noted that the imposition of restrictions on their daily routines helped in reducing the prevalence of the pandemic in the country, and the government had been left with no option but to reintroduce some of these restrictions in order to help save the situation.
Has more than doubled from a little over 1,900 2 weeks ago to 5,358 currently. When I delivered update number 22, 13 out of the 16 regions had recorded active cases. Today, all 16 regions have active cases. Indeed, Greater Accra, Central, Western, Ashanti, Eastern, Upper East, Upper West, Volta and Northern regions are the hardest hit, accounting for 94% of the total number of active cases. In effect, fellow Ghanaians, we have a lot of work to do in coming to grips with the disease, and government has been left with no option but to reintroduce some of these restrictions in order to help save the situation. I know these measures in the recent past were unpleasant, but over a period, they resulted in a favorable situation for the country. We have to return to them.
The president said the National Sports Authority and the Ghana Football Association should ensure compliance with the 25% capacity rule in our stadia, with spectators respecting the social distancing rule and wearing of masks.
The Health Facilities Regulatory Agency, HEFRA, has shut down 4 health institutions in Accra for operating without license. The affected institutions are the Advanced Bodies Corps Center, also known as the Obinfo Hospital at Waja, the Susan Clinic at Latabi Okoshi, the China Recovery Clinic, and the Grace Diagnostic Clinic, both located at Achimota. The Health Institutions and Facilities Act 2011, Act 829, which established the HEFRA, empowers it to shut down any health facility which does not meet standards established by the law. Per the law, a person shall not operate a health facility unless it is licensed under the Act. A team, led by the Registrar of HEFRA, Dr. Philip Bano, closed the facilities last Friday in an enforcement exercise being conducted by the agency. The team, comprising officers of HEFRA, the police, and personnel from the Ghana National Ambulance Service, stormed the facilities unannounced and closed them after they had failed to produce their license. 2 of the closed health facilities, Susan Clinic and China Recovery Clinic, were not operating when the team arrived on their respective premises. At the Susan Clinic, it was gathered that the operator of the facility had not been practicing since 31st December 2020, following his arrest by the police over some illegal activities at the clinic. The China Recovery Clinic, on the other hand, had its gates locked with no official of the facility present when the team from the HEFRA got there. The team pasted closure notices at the entrance of the clinics to officially signify that the facilities had been shut down. Briefing the media after the exercise, Dr. Philip Bano said the move had become necessary since some health institutions were operating below standard and many of them were either not licensed or registered with the agency.
To close this facility, and as you see, we put a padlock on it. And then we'll be issuing additional instructions to the operators and the owners of this facility to come to HEFRA and to find ways of how to comply. Did the operations, and then we found out that it's not licensed. We're giving them opportunity to comply, and then that has not happened. So that is why we've taken this measure against the facility. I think we've given them enough time, and even in the pandemic, you still have to comply with the rules. Because some people will use that as an excuse to do all sorts of things, some of which is already in the media. I don't need to repeat them here. Such activities cannot be allowed.
He appealed to the public to support the agency and report any health institution suspected to be operating without a license or permit for action to be taken. South Africa, the continent's worst COVID-hit country, is due to receive its first batch of coronavirus vaccines on Monday, 1st February 2021. Initially scheduled for the end of January, the first 1 million shots of the AstraZeneca Oxford vaccine produced in India will be used to inoculate healthcare workers over the next 3 months. The second batch of 500,000 jabs is scheduled to arrive later in February. Despite criticism from opposition